I'm Dr. King, so I know I gave a little spiel earlier. I'm going to tell you guys a story because I think for me, storytelling is really helpful and insightful in terms of figuring out your story and where you are in your journey. I knew nothing about osteopathic medicine up until I was applying to medical schools. I come from a family of MDs. My grandfather went from being a potato farmer in North Korea to being a apprentice in an herbal medicine and acupuncture clinic to becoming a physician before medical schools existed. And in Korea, MD was the degree you got as a doctor. So he kind of climbed the ranks through that and immigrated with his family over to California, where most of my family is. My mom, who's a child psychiatrist who's retired, did her residency out in University of Maryland. And growing up, I mean, I certainly felt that being a physician was kind of expected. And maybe I resented that a little bit growing up because I was really driven into arts and being an artist since I was like the age of 2 or 3. And was trying to find myself. Even through medical school or through high school and college and medical school, I was like, how do I want to give something back to humanity is ultimately what it comes down to, at least for me. So whether that was through being an artist, maybe getting an MFA after graduating college, maybe it is applying to medical school and going the route that my parents and my grandfather did. And I think what it kind of came down to was finding the right fit of a profession where you could be a physician and an artist at the same time. When I was thinking about applying to medical schools, my pre-medical advisor actually, I went to Muhlenberg and she was like, PCOM is like right 30 minutes to an hour away. And I'm like, what is that? Like, she's like, well, it's osteopathic medical school. And I was, really Googling it and learning about it. And I was a sculpture and neuroscience double major. So she's like, you are the prototypical perfect candidate for being a DO. And after looking it up, I was like, I agree. Like I wanted to work with my hands. So I'd been shadowing orthopedic surgeons in my hometown around DC throughout college, right? And so I was like, oh, perfect. Combination of hands, power tools, and fixing someone. Like, I love that. Little did I realize in medical school, I learned that I was indeed neurodivergent and have synesthesia. So being in an inpatient environment was highly triggering for me, unfortunately. And being in an OR made it kind of even worse. So like the lights, the sounds, the high stress, I just wasn't for me. Plus I like to snack every hour. So that's not ideal for a surgical environment. So I was like, okay, not orthopedic surgery. Sorry, that's out. Then I was like, well, what am I going to do? I mean, I love fitness. I love sports. I love biomechanics. I need to work with my hands to keep myself sane. So I guess PM&R, sports medicine, family medicine. So I started really going to PM&R conferences and sports med. And I found that I fit, like I could pass and fit and kind of schmooze in that realm, but I never fully felt like myself. I eventually did a lot of internal work and investigating and meditation. As a Buddhist myself, I really believe that doing that dive inward helps you give more things outward to other people. So I was like, who am I? What are my tools? What are my skill sets? What am I passionate about? What would I do every day if money was not a thing that I would just do while existing on this earth? Well, it was really osteopathy. When I started going into my rotations, I kind of insisted on treating patients to the chagrin of some of my attendings. They're like, why do you want to keep doing OM on them? Like, we're busy, come on, let's go. And I'm like, dude, I'm just trying to get better. Like, this is what it's about, right? Like, learning what I can give back, learning my talents, learning my skill set, and how I can help people feel better. And luckily for me, on my family medicine rotation, this is towards the end of my 3rd year where I was like, okay, I'm applying PM&R or sports. That's my route. But I just really want to get better at OMM on this rotation. So this was my family medicine core rotation. Dr. Ken Fox, who was with ARIA, which is now Jefferson, I believe, up in Torresdale, Pennsylvania. And do people rotate with him?
Yep,
okay, so he's a legend. I literally gave him one of my paintings. Yeah. He let me treat every patient. He's like, here's your room. You're going to sit in this room and do OMM on everyone. And I was like, oh my God, that's so fun. Like, yes. And wouldn't you know it, like after the patients left, they'd ask the front desk, they're like, can I see that young doctor in room whatever? I need to come back in 2 weeks. My shoulder feels better, but I need to keep this up. And I was like, I'm not a doctor. I'm sorry. Like, I'm a third-year student. I'll talk to my attending and maybe he could see you. They're like, no, no, no. Like, I want to see you. You're the guy. You're the only one who treated me. And that literally driving home on the Ben Franklin Parkway is when I realized, I'm like, oh my God, like I'm actually not tired. I'm actually energized from my day. I'm happy. I switched specialties within a 10-second time frame, which can be very scary, right? Because it's like, okay, my whole life trajectory just went like that. But the great thing about knowing yourself at your core is that you're secure with that decision. If you're listening too much to all this other chatter, right? Even your siblings, your parents, your best friends, they're looking at you from the outside. And yeah, they've known you for decades or your whole life, or maybe even created you, but you know the current status of your own spirit, your own consciousness, where you want to be in 10 years, 20 years, 30 years, 40 years, the legacy you want to give back to everyone in your community. And so in that decision, I, of course, called my mom. I was like, hey, Mom, I really like that OMM stuff that we learn. Well, I'm just going to do that for forever. And she goes, okay, I know, honey, you're ADHD. I know you like to make quick decisions, but just think about it. I'll look it up and get back to you. And I was like, okay, cool. Well, I'm doing it anyway, whatever you say. And she did. She called me later that night after talking with my dad, and she was like, honestly, she's like, this is like you. Like, this is your thing. Like, you, ever since you were a kid, you were just tinkering around with toys and figuring out problems and using your hands and making sculptures. And she's like, you're going to be really good at this. And with that kind of validation, I felt really good, even though I knew, even if she was like, nah, don't do that, I probably would push back and just be like, I'm doing it anyway. That just gave me that extra kind of push forward into pursuing it and doubling down on this. I think when you line something up with your passion, your innate talent, and the giving back to everyone around you and your patients and your colleagues, you will be successful. And then based on what that success is to you, I think monetary success is maybe 50th on my list in terms of what is success. Top of my list is how many people have you helped in your lifetime, whether that's someone who you've taught, someone who you've treated and taken their suffering away. Those to me are in like the top 3 to 5. Other things for me would just be personal fulfillment of teaching and having a family and being there for my family. And some of the specialties, unfortunately, didn't line up with me on that. For me, money was never really a thought because, we all have student debt, right? It's going to be a thing. But you can still make a great living being a physician doing literally any specialty. So for me, that didn't really make it into the calculation. But the other top thing was teaching and being a mentor. And I think OMM as a specialty and being a DO really drives that home because we are a tight-knit community, even on a national scale. We are a minority in the national scale. And I think that necessitates the need for mentorship, especially in different specialties where there's not a lot of us. So I think all that being said was I found my fit. I am very thankful for being a DO and being in the position I am, because if I was anything else, I wouldn't have found osteopathy and really what I was put on this planet to do. And so I want you guys each to take that internal journey and find what that is for yourself. Maybe it's being a pathologist, maybe it's being a radiologist, maybe it's being family medicine, sports, PM&R, what have you. But just keep that all in mind and use that to write your journey and your story moving forward, and know and stay true to yourself, because you're going to hear a lot of things on your path that make you want to deviate. But at the end of the day, it's your life and it's your day-to-day workflow. So keep that in mind. I think you should make a priority list and literally write it down by hand and say, these are my priorities, and here are the pros and cons of these specialties that I want to go into and how they line up with these priorities. Because doing it in that structured way is going to really give you a clear answer like it did for me. And it makes it a little less confusing. So again, if you need any assistance with that, just reach out to me. I've done it for a lot of students at Rowan, but also outside of Rowan, at various levels of training even. Like I'm advising attendings too, who are like, I picked the wrong path, what do I do? So that's my spiel. Thanks for listening to my TED Talk, and I'll turn it back over. Board scores, yeah, cool, you passed, great, but for what I do in OMM specifically, it's like, how are you interpersonally? For me, it's like communication skills, your vibe, like how do you work with people as a team member or a team leader? Because ideally, I want each of my faculty or residents to be leaders. And being a leader, you know how to follow when you need to. So if I see someone who is great on paper and they have like everything's stellar, but then I'm interviewing them and I get the sense that they are kind of not a team player, that is a big detractor. So, for example, when I'm looking at medical students who are on my service, who I'm like, yeah, maybe they want to be in my residency, or maybe they want me to advocate for them to be in a residency by writing them a letter. I really want to know who they are, why they do what they're doing, and what their passions are, and how does that cross over into patient care. Really, as a resident, you're an employee. You're part of a team. You're working with MAs. You're working with your attendings. You're working with the practice manager. You're working with your patients, their families. And if you're not able to fully integrate yourself into a team structure, that's to me, it's a red flag. And how do you be a really good team member? It's communication. As a chair, right, I structured my department into different team leads. Those team leads have their own core people, and there is a chain of communication that is constant, flowing and evolving and adapting. So that is generally what I believe creates success in a mission, is are those leadership and team players. And then when I'm looking at having a resident, I think board scores are very kind of lowish on my list personally, but I'm also not like an ophthalmology residency director, which is highly competitive. But there is, for example, even getting to your spot right now, you had to do well on your MCAT. You had to achieve a certain benchmark, and we set those benchmarks at it. Being in the admissions committee, we have benchmarks, and that's to mitigate risk. So as a program director, I'm thinking of how do I mitigate my risk with having this person who I'm employing, and I really hope they follow through with flying colors, because if they don't, then I also have to think about, how does it look for our program? How does it look to the ACGME, who we have to answer to for accreditation? So there's a lot of things to weigh, but that's just kind of like my take on it. When I write letters, I put the context right away, and I'm like, I've worked with this student for 3 years on 5 research projects, and they are definitely chief resident material for whatever program they're going to go into. And at the end of the conclusion of my paragraph, I just put, this student is in the top 1% of students who I've worked with. Just so as a program director who's looking at 600 applicants, they can just see immediately the caliber of this person from someone who's worked with this person for X number of years or months. If you request a letter from someone who's not your mentor and you did 3 days with on a rotation, guess what the quality of that letter might be? Not as high as someone who you've kept in touch with and worked on many things with over years and years and years. So that's why I'm saying first year, second year, really, and even third year, it's not too late. You just hit the ground running with finding someone who you can work on a project with, have constant communications with, who can get to know you as a person, not just as like a student on their service, right? And then really just choose wisely. Choose who you're asking for these wisely. So practice in what you might want to do. So that's number one. Number two would be jumping on a research project that's either adjacent to or in that field. For example, let's say you want to do ophthalmology. DO ophthalmologists are not super common. So I'd find someone who is that in your local area, whether it's a cold email or maybe I know them or someone knows them, and they can advocate for you, like, hey, my student's going to reach out to you. Is that okay? They'll be like, yeah, sure, that sounds great. Then seeing if through our research departments at Rowan, you can hop on a project that someone either has ongoing or that there's a grant and that's like funneled into your specialty that you want to do or something like that. Even if you can't find anything within that specialty, just try to hop on something anyway, because what those high-level specialties are looking for, not only stellar board scores, which are going to be like top percentile, whatever, but also how much research have they published? Is it 1 paper, 2 paper, 3 papers? I had a PM&R student, shout out to Seth, who published like 19. He is top shelf guy. So you could always reach out to him if you have research questions. But that would be another top level thing. Number 3, going to the conference every year. So let's say you want to be a DO ophthalmologist. You go to that conference, and I think they just had it because one of my best friends, she's an ophtho. But you go to that every year, do their student track, make that investment. I know it's probably going to cost a lot of money, but you have to think in return on investment, right? If you're the one student there because it was too much of a hassle for all the other students in the country to go, guess how much focus and attention you're going to be. They're like, there's a student here. She's in a second year or third year. That's crazy. That's going to look really good, and those are the opportunities where you network. You get out there, you go to the water cooler and talk to someone who's just like looks lonely. You're like, hey, what do you do? And you never know what can happen. So I would say those are my top three things. Yeah.